Dear participants, dear panelists, my name is Rada Zakharieva. I'm Policy Coordinator for Health Inequalities and Roma Health at the European Public Health Alliance. I'm also coordinating the Roma Health Network, which was established in October last year and comprises a wide range of stakeholders, such as civil society organizations, academics, and advocates striving to achieve health equity. It is my great pleasure to welcome you on behalf of the European Public Health Alliance to this workshop addressing the role of early childhood development for tackling health and social inequalities through European and national policies. The European Public Health Alliance has been committing to address structural inequalities which affect disproportionately children and families from vulnerable and socially excluded groups by investing in projects and campaigns aiming to tackle health inequalities from the first years of life. Indeed, early childhood has been recognized as a crucial period for interventions for combating existing inequalities and preventing their negative impact in adulthood. In 2010, the Marmot Review addressed early childhood development as an integral part of sustainable strategy for reducing health inequalities, linking it to social justice. 10 years later, these interrelations are still valid and pertinent. Early childhood is a crucial period for influencing multiple social determinants of health and provide the conditions for individuals and communities' lifelong health and well-being, but also for advancing equality and equity across Europe. The lower access to quality maternal and child health and prevention services, vaccination, affordable medicines, decent and affordable housing, child protection measures influence children's health and increase their vulnerability to health and social inequalities in adolescence and adulthood. Therefore, early interventions are essential for reducing disparities between population groups and advance social justice across Europe. This is even more relevant for children and parents from vulnerable and socially excluded groups such as Roma and Travellers, migrants and refugees, children with disabilities, those at risk of placing or those who are already placed in alternative care, which are facing greater exposure to child poverty and its devastating consequences. In March this year, the European Commission presented the European Pillar of Social Rights Action Plan, aiming to strengthen policy commitment to advance socioeconomic rights across Europe. It came at a crucial time for Europe as the COVID-19 pandemic revealed the extent of long-standing health inequalities between and within countries, hitting hard the most vulnerable population groups. While the recently adopted action plan shows significant political will to boost the implementation of the European Pillar of Social Rights, there is still many questions concerning the plan's capacity to tackle the growing health and social divide affecting vulnerable and socially excluded families and children. Those are important questions that we would like to address during this 2-hour workshop, part of the social platform flagship conference provided as an official side event of the Porto Social Summit. During this workshop involving major civil society organizations and representatives of the European Commission and the European Parliament, 2 key recommendations on the European Pillar Social Rights Action Plan will be formulated, incorporating the outcomes of the 2 sessions. For these reasons, I would like to invite you to use the Q&A box for raising your questions, which will be addressed during the Q&A sessions at the end of each panel. Also, you can contribute to the discussion by using the hashtags Building Social Europe, First Year's First Priority, and Early Childhood Development on social media. The whole event is going to be recorded and the recordings will be available on the organizers' communication channels and will be disseminated following the event. Now, Jaina Hansworth is going to provide the welcoming remarks on behalf of the Eurochild. Jaina, the floor is yours.
Thank you very much, Radost, and welcome to you all to this workshop, which, as Radost said, is organised as part of the Civil Society pre-summit to Porto. And we are organising this workshop together with European Public Health Alliance this afternoon for 2 main reasons. The first is really to share the work that we have been doing over the last 2 years to build up a new campaign called First Years, First Priority, which works on promoting early childhood development with a number, and we're working with a number of civil society peers. The campaign is led by Eurochild together with the International Step by Step Association, and you'll hear from both myself and Michaela Ionescu in the first panel to explain a little bit more about the rationale and the activities of the campaign. European Public Health Alliance and the Roma Education Fund are also associate partners. But we know early childhood development is a key interest of many of our civil society peers. So we really wanted to bring others together in this platform, and delighted to have inputs from the disability sector, from the migration sector, so that we can share experience and see how we can build on each other's strengths to put early childhood development higher up the political agenda. And the second reason is, of course, with this political opportunity of the action plan on the pillar of social rights, we want to bring a stronger early childhood development perspective as a follow-up to this pillar. We know that childcare, and more recently mostly referred to as early childhood education and care, has been and continues to be on the EU's political radar, but it's rarely addressed from a children's rights perspective, and it rarely takes a holistic perspective on the different services and supports that families need for the smallest, at the earliest years. And this is what we want to, this is the gap that we want to address. So, as you're aware, the workshops that are organized as part of this, pre-event are working towards some recommendations, and we will be finalizing those recommendations as we listen to the presentations and the questions and comments. But most of what we are thinking about for those recommendations is first, that we want the target on reducing child poverty, which is very welcome commitment in the action plan for the pillar of social rights. We would like that nonetheless to be focusing on early childhood, in particular under threes, and so get disaggregated data. And secondly, in relation to pillar 3, which focuses on equal opportunities, we really want to make sure that we're tackling discrimination and inequalities in the earliest years, to invest in communities, parents and families from the earliest years. So without further ado, I think we can move now into the first panel, and I'm going to pass the floor to Agata Dadato, who's Senior Project Manager in Eurochild and is the coordinator in Eurochild of the First Year's First Priority campaign. So Agata, I give the floor to you. Thank you.
Thank you, Rados. Thank you, Jana, and welcome everybody. My name is Agata Dadato. I'm Senior Project Manager at Eurochild. I'm really delighted to moderate the first panel of this workshop, which is looking at the importance of tackling exclusion and inequality in early childhood. I would like to introduce the panelists and the topics that they will address. Jana, our Secretary General in Eurochild, together with Michaela Ionescu, Program Director at ISA, the International Step by Step Association. They will talk about our recently launched First Year's First Priority campaign, which is a campaign specifically designed to achieve a fair start for every young child in Europe. Then we will hear again from Rados Zarieva. Rados is a Health Inequalities Policy Coordinator at the European Public Health Alliance, and EPHA is an associate partner in the First Year's First Priority campaign. Rados will talk about early childhood development as a major component of health equity, with a particular focus on children from vulnerable groups. And then we welcome Barbara Norris and Maureen Piggott, They will close this first panel with a contribution on reducing exclusion and poverty among children with disabilities through integrated measures for early childhood development. Barbara is an experienced self-advocate. She will talk about her early years and how the services she and her family received have influenced her life chances and her choices. And then I will give the floor to Maureen, who is a treasurer and board member of the European Disability Forum. So these are the panelists for this first part of our workshop. And I'm now inviting Jana and Michaela to take the floor and to walk us through the main characteristics of the first year's first priority campaign. Thank you.
So I will briefly give a bit insight to this campaign, which, as you can see, is co-led by Eurochild and EPHA, and has in partnership the European Public Health Alliance and the Roma Education Fund. And we launched it in December of last year. So we're situating this campaign at a time of enormous challenge and also enormous opportunity. So we know that the pandemic is having a disproportionate impact on the most vulnerable in our societies all over Europe, and that unless we prioritize investment in the most vulnerable as we plan our recovery, we will jeopardize Europe's long-term prosperity and stability. We're also increasingly conscious and aware that everything is interconnected, and we absolutely need to have a more integrated approach to policy making. And there's perhaps no area of policy that is more in need of an integrated approach than in early childhood. And we're also in a situation where there is an extraordinary economic stimulus package from the EU and a plan for recovery that, if it remains true to being both inclusive and sustainable, it can transform our societies and economies for the better. This is the context, the external context, and we believe that this campaign is situated. What we are aiming to achieve with the campaign is, it's an advocacy campaign, so it's influencing public policies and spending, taking advantage of the EU policy developments and the next EU's budget framework to ensure that all families, but in particular those who are living with adversity, and Rados talked to this earlier, those families with children with disabilities, families of migrant background, those children who are at risk or already in alternative care, children living in precarious family situations. These families get the support that they need to provide a healthy and safe and nurturing environment for their youngest children. We're focusing on children under the age of 6, but we have a specific focus, because we feel that this is a significant policy gap, on children who are under the age of 3. What is important about this campaign is that we're looking at early childhood development from a holistic perspective. And we're building on the foundations of important bodies of knowledge that have been built up over the last decades. Perhaps most importantly, the body of knowledge linked to the nurturing care framework of the World Health Organization, endorsed by UNICEF, which focuses on 5 key areas, which, for those of you who are familiar, know that it's not the same 5 areas that sit at the 6 that we have on this screen, but I'll mention them. So that's early learning, health, safety and security, responsible caregiving, and nutrition. Now, we've incorporated that thinking into our work, bringing on board a more European perspective. And as most of the participants here today will know, a very important milestone was the 2013 Investing in Children recommendation that had the 3 pillar approach to investing in children, access to resources, access to services, and children's rights to participate, that has informed and now built the recently launched recommendation on a European Child Guarantee Initiative, builds on that framework and aims to ensure that all children have free access to childcare, good nutrition, healthcare, housing. So we are incorporating that thinking into our 360 approach. And these are the six areas that we are having a deep dive into influencing. So we're focusing on maternal and child health and nutrition, talking about social protection, early stimulation and learning, family environment, cross-sectoral coordination, and child poverty. Now I'm going to pass the floor over to Michaela, who will talk to this and then how the types of activities that we are implementing as part of the campaign. Michaela, the floor is yours.
Thank you so much, Jana. So while it might sound very ambitious, I think that we have tried as much as we could use our expertise and experience as organizations and networks operating in Europe alongside hundreds of constituencies that we are representing. We have thought what actually we are committed to achieving. And I think that the 6 areas that you have presented on this slide, Jana, just shows that all these areas are having a huge impact on the development of the child. And that's why, and this comes from research and practice equally, and has been reconfirmed in many other frameworks that have been used either globally or regional or even at the country level. So if we move to the next slide, Jana, we will just say that we are very much committed to achieving more understanding and political support for ECD, harnessing on existing EU policies and funding, but also considering what other policies would be needed to articulate this comprehensive understanding, more investment in ECD. And I think that the context we are living now, we were not even dreaming in 2019 when we were thinking about this campaign. And I think that now we can consider that this is a test for many of the European countries, how much they would really look at early years. Action on child poverty and social inclusion. Again, the momentum is here, but how this will be reflected in national strategies. Will there be early childhood development strategies and social support and measures to combat discrimination? The integrated approaches, which is not a new concept, but it's hardly that can be seen at country level and also in Europe, at the European level, that is looking across areas of policies in terms of policy development, but also policy implementation, that they keep the children at the center. And now with the new strategy, a European strategy on the children's rights, I think that we have another serious anchor. And the EU funds, we would expect EU funds to support reforms and investments in ECD. And again, I think that now it's a good timing also with the plans for national plans for recovery and resilience to see to what extent countries will really look at the future by paying attention to the youngest ones. Hopefully, I mean, it's a multi-year campaign. So I think that we are building our achievements over the years, and we are trying to do that by activating 3 main components in the campaign. One, and perhaps nobody can deny that, we cannot do it without having a community of ECD advocates, and that's at the national level and also at the EU level. I think perhaps it's one of the moments where we could have perhaps a bigger traction in getting alongside us other organizations in the civil society and join our voice. A second component is leveraging the EU policies and funding to support reforms and public investment at the national level. And again, I think we are really fortunate to have a context that can help us into this with the most recent policies that have been issued and are planned to be issued at EU level. And raising the awareness of ECD and collecting and disseminating a strong evidence. And I would just pause a little bit here because I think it's very important that usually advocacy needs to be well informed by data and by evidence. And I think this is what the campaign also is trying to convince for raising this awareness, that a lot of information that comes from data, from country level, be that in the fact sheets that we have developed, be that in the case studies that we have developed in the campaign and can be found on the website, but also through the country profiles that we are planning to develop, which will be anchored in raw data where it exists, because you just made a good point at the very beginning, how much disaggregated data we have for the youngest children in countries and at the European level. This is very important to raise the awareness. No data, no progress, it was said at a certain point. So I think this is so crucial in the campaign. However, again, if we are building a community of ECD advocates at national level, we will not be able to do this alone. So we are going to move to the next slide, Jana. And we are going to do this with our partners, be that members of Eurochild or of EPHA, in 9 countries. As you can see, in Bulgaria, in Finland, France, Hungary, Ireland, Portugal, Romania, Serbia, and Spain. These are the 9 countries that we are having closely involved at the moment in the campaign, hoping that we will have other supporters in other countries in Europe along our way in the next year. However, as we were mentioning, that both levels are in the focus of the work of the campaign, European level and the country level. This we are going to achieve through a bottom-up and top-down approach, meaning that while we are building this capacity to advocate at the country level through national coordinators as members of EPHA and Eurochild, but also national coalitions that are getting around the national, catalyzing, mobilizing this expertise at the country level, to be the ones that are the voice of the children, the ones that are identifying which are the most pressing priorities that are regarding child development along the 6 areas of policies that we were mentioning at the beginning. Where the priorities is the most, what are the areas where that more investment would be needed, so, as none of them would work isolated and they are closely intertwined. And through this bottom-up and top-down approach, meaning that the European partners that we have involved in the campaign, Eurochild, ESA, REF, and EPHA, are the ones that are activating, let's say, the European supporters and advocates, and also putting all their efforts in influencing the EU policies and decisions that are impacting or guiding the policies at the country level, while our national partners are the ones that are being aligned in the messages that they are sending to the constituencies in their countries and to the political decision makers in their own country. We hope that although the times are quite dynamic, I would say, in terms of shifting priorities, but also on competing priorities, we can only be the ones that can guarantee that through the campaign, a lot of civil society organizations are committed to keeping the early years and the young children high on the agenda of countries and European Commission. Diana, you may want to say a few words about what colleagues can also get inspired or use from the work that we have so far done.
Yes, thanks, Michaela. I think that the main philosophy of the campaign is that whilst we have extraordinary opportunities at EU level and we want to push for a really ambitious implementation of the action plan on the pillar of social rights, the European Child Guarantee and others, how they land in national level is absolutely crucial. And the context in all of the countries is so different that we really have to have ownership from national civil society to make the best use of these important policy and funding levers to deliver change for children. So I'll just finish with the last slide. We have quite a few resources on the First Year's First Priority website. Last week, we actually launched our policy brief, which kind of explains in more detail the 6 areas that we're trying to address in this holistic, comprehensive approach. We also have information from each of the 9 countries. ESA is working now on developing more detailed country profiles with some of the data that Michaela talked to. And we also have some some case studies which are looking at what kinds of policy and service interventions we believe are consistent with the values that we're trying to push for in this early childhood development campaign. So I'll stop here, Agata, and leave you give the opportunity to the next panelists.
Thank you very much. And attendees will find in the chat the links to the relevant materials and to the website, and also the where to sign up to make sure that they get on board with this campaign if they wish so. Rados, the floor is yours.
Thank you very much, Agata. As my colleagues Jaina and Michaela have mentioned, it is greatly important to address holistically early childhood development, but also to emphasize its role as a major component of health equity. Actually, health equity is a very complex issue depending on major social determinants of health, and their uneven distribution lessens the opportunities for healthy and optimal growth and psychological development in early childhood. The first years of life are crucially important for reducing health and social inequalities between and within countries. This period is characterized by intensive physical and mental development requiring healthy diets, quality health care and prevention services, equal access to education, decent and affordable housing, but also equal access to social services to ensure the best start in life and prevent inequalities which children may face in adolescence and adulthood. Nevertheless, many children, especially those belonging to vulnerable groups, such as Roma and Travellers, refugees and migrants, children with disabilities, and those in alternative care, are deprived of equal opportunities to grow and develop in a safe and healthy environment, which raise their exposure to health and social inequalities. The figures illustrating child poverty and deprivation in EU member states are alarming. In 2018, more than 22% of Europe's children were at risk of poverty or social exclusion, with the highest rates recorded in Romania, reaching almost 38%, followed by Bulgaria and Greece. Poverty is even deeper for children from marginalized communities such as Roma, where poverty reaches 80% of the population. Moreover, around 30% of Roma children face malnutrition, having devastating effects on child healthy growth and increase their vulnerability to ill health in adulthood. Deep and generational poverty experienced in the earliest years of life results in higher exposure to hunger, malnutrition, but also poor health, both physical and mental, and lower socioeconomic participation in adulthood, creating a vicious cycle of poverty and exclusion affecting entire generations and communities. Children from vulnerable groups remain widely exposed to poverty and social exclusion, influencing their living conditions, health status, safety, and early childhood development as a whole. Growing health inequalities having long-term consequences for children, their families, and entire communities, increase also exposure to generational poverty, which is also rooted in unequal treatment in key areas of life, including health. And as a result, it decreased drastically the opportunities for addressing disparities within population groups and thus advancing health equity across Europe. These substantial health and social gaps are significant obstacles for promoting social cohesion within member states, as well as in contributing to the achievement of the United Nations Sustainable Development Goals. Therefore, reducing child poverty is a precondition for advancing health equity in European societies. Providing children with optimal conditions to grow in a safe and healthy environment needs a number of actions to holistically address major social determinants of health and reduce inequalities between population groups from the first years of life. Such measure will have positive impact on child poverty, but also community health and well-being, gender equality, and social fairness as a whole. The unprecedented crisis provoked by the COVID-19 pandemic and its disproportionate socioeconomic consequences for vulnerable children revealed the extent of structural inequalities in access to healthcare and prevention services, including vaccination, pre- and postnatal care, but also it demonstrated the gaps and limitations of social protection systems, raising further the health and social risk for vulnerable women, their babies, and young children. This public health crisis and its socioeconomic effects on the most vulnerable have shown the human and financial cost of poor investment in vulnerable and socially excluded groups facing inequalities in strategic areas of life. These consequences were avoidable and preventable, and they should be addressed through policy measures treating holistically the causes of health and social disparities faced by vulnerable groups, including structural discrimination in strategic areas of life. In this regard, the prioritization of early childhood development with a focus on vulnerable children should be part of European and national policies related to Europe's socioeconomic recovery and resilience. Furthermore, the holistic early childhood development of vulnerable children needs to be specifically addressed through targeted measures in line with the needs of children from vulnerable groups and must include assessment, concrete action plans, timelines, indicators, and progress monitoring in crucial aspects for healthy early childhood development. A comprehensive early childhood development policy frameworks for addressing the needs of these children can break the cycle of poverty and marginalization of entire generations and communities, ensure that they have healthy places and equal opportunities to develop their full socioeconomic potential and contribute to Europe's socioeconomic recovery. Moreover, early childhood development is recognized as a strategic factor for social cohesion, but also advancing equality and sustainable development of societies and economies, in line with the United Nations Agenda for Sustainable Development Goals, and more precisely, for combating inequalities between and within countries, eradicating poverty, promoting gender equalities, as well as reaching global targets in health, nutrition, education, and prevention. Thank you very much, Agatha.
Thank you for this contribution, Radost. I'd like to invite Barbara and Maureen, please.
Next slide, please. So this is my early years. This is a picture of my first steps. Before I moved to this house, I did live in a place called Moira in Lisbon, and I have second of my 4 children, and I have a working mum and dad. When I first moved to Belfast, I was in Seagull House, so that was run by MinCap. My mum and dad received information and help for support for my diagnosis of me having Down syndrome. And I also my parents got a lot of advice and support to help me. And then my mum and dad got some parent and baby activities, sessions to interact with other people as part of other people's families. And I attended Seagull House when at the age of 2. I had health and social care and education professionals that helped me to work with my mobility and my speech therapy and things. And I was also planning for the next stage, so what was going to happen after that. And also because my mum and dad were part of support groups that helped me become into access to other places that could help me. Next slide, please. So these are pictures that represent my my social activities that had happened with fundraising through nursery in my Seagull House days. And one of them is the first picture from Castle Ward, where we had a circus going on in Castle Ward, which involves quite a lot of my social activities because we were fundraising for a charity through MenCap. The second picture represents me in Seagull House in my classroom using the touchscreen computer. The touchscreen computer is dragging things along and directing the people on the screen. The last photograph is me when I started my primary school straight after Seagull House, called Harborton. And that was a good day. And I also did learn Makaton when I was in Seagull House, and I did had some, because I couldn't speak properly, I had to use some speech therapy sessions to help me progress my speech. Makaton is kind of like a sign and symbol system, which is kind of like British Sign Language, but it teaches in a way that it develops in other people with disability language. And that was me in my school uniform in Harborton. And I moved from nursery to school, and I continued to use speech therapy and began to talk clearly after that. Next stage, next slide. This is my adult me. So this picture represents my family at my 30th. I now live in Northern Ireland, and I live in my own flat with support from my family. And I also went to secondary school. I did experience bullying when I was, and I got picked on because of my disability, but that was only because there was not enough children in the school with a disability. I went on to further education and employment and work experience, and then I've also got my paid jobs. I'm also an inclusion consultant and campaigner for MenCap, and I have employers from support from Orchardville, is a society that supports people with disabilities to get jobs. And the friends that I made through my experiences were really important to me. I'm part of different groups, and I have family and friends. Next slide. This is the wishes for my future. So I'm looking forward to having a bright future. I would like to have support and help to meet the challenge and achieve my dreams in marriage and family with my partner. I would like to gain a support group in order to help people with disabilities experience those things, and to help me as a couple and as a parent. But I also like to introduce a welcome pack with information on the for care for their baby for the future, where to get support and advice from, and what was positive about the child and their future. Thank you very much.
Thank you, Barbara. Barbara makes the case, as others have done, for early years support for the developing child with a disability and their family. The services that she received were the result of integrated delivery by education, health, and a major NGO for people with disabilities. Without that integration, families face the challenge of if there are services available, uncoordinated services that add to their stress. When I chaired the review of services a few years ago, we heard of a family having 249 appointments in 1 year. Another family had 19 visitors to the home, from education, from health, and different branches of both. Worse than uncoordinated services are none at all. And for too many families, that is the case. Services do not adapt, mainstream services often do not adapt to the needs of the disabled child, and particularly for children in rural areas or facing poverty, this can be a particular problem. Added to that are attitudes. Maternal and child health services all too often still do not show that they value the child and see the child's potential if the child has an identifiable condition that may lead to a disability. Faced with those challenges and the uncertainty, and with the compounding effects of poverty, this drives many families to agree to have their children cared for in an institution where they will be fed and cared for. And sadly, this is still a frequent experience for too many children in Europe. Often it's intended as a short-term alternative care solution, but our experience shows that this leads to long-term segregation, total exclusion, and often to life and death in an institution. So the solution is integrated planning and integrated policy. The EU is taking early childhood development seriously. We see in the Child Guarantee and the new Child Rights Strategy many of the right elements. And today it's great to see that we have 3 DGs taking part in the next session, because that is what's required, a coordinated strategy to ensure that families have income to achieve a decent standard of living, access to employment. And for that, we need childcare that includes children with disabilities, and often beyond the years that a typically developing child needs. A recent UK study showed that 93% of the parents of disabled children who were not in work wished to work, but had no access to childcare. In addition, poverty is exacerbated by the costs of disability, which are considerable. An Irish study shows that the costs of having a disabled family member increase family spending by up to 24%. In the UK, 24% of parents of children with disabilities required an additional €1,000 a month just to achieve the same standard of living as others. So the guarantee is a very good start, but we need housing, accessible, affordable housing, or help with making adaptations. We need access to education so that no child is left behind. To achieve that, disability needs to be visible and mainstreamed in every policy. It isn't sufficient to assume that rights will be respected. So solutions are connections to children, young people, and families of the children with disabilities through DPOs and NGOs to understand their needs and circumstances, and a commitment to the obligations the EU and its member states have signed up to in the CRPD. So thank you very much.
Thank you. Yes, Maureen, if you can, switch off your mic. Thanks. Thanks a lot to our 5 panelists to share their inputs, their expertise, and their experience. I invite you, I encourage you to share your thoughts and reactions in the Q&A chat, and we might be able to come back later on different aspects. In the second panel, there are a number of distinguished speakers that will react and reflect on issues highlighted by this panel speakers. So thank you very much. And I'm now delighted to leave the moderation to a great champion of child rights and early development, Geraldine Libreau from the European Commission, DG Education and Culture.
Thank you very much, Agatha. Good morning. Well, good afternoon. Yes, indeed. Thank you for inviting me to this workshop. As the policy officer for early childhood education and care in the European Commission, I'm glad to say that the European Union has been stepping up its efforts in the recent years to support children's rights and the fight against poverty and social exclusion. And our speakers in the panel today will tell us more about that. From my side, I would like to say a few words on how much we value access to quality early childhood education and care by all children, regardless of their individual circumstances or abilities, and also regardless of their family background. So in 2019, member states have reaffirmed their commitment to provide such quality education and care to all the children from their early years in a council recommendation. And since then, the Commission is working to support the member states to achieve this. So we have recently published a toolkit for inclusive early childhood education and care. And we are also currently running a series of webinars to explore this. In our work, we do pay great attention to develop general inclusive measures, but also additional specific measures to address specific groups, such as the children with disabilities, children with a migrant background, Roma children, or children living in poverty. So in this context, I'm really happy to introduce our 3 speakers for this panel. We will welcome Alina Smith from the Platform for International Cooperation on Undocumented Migrants, also called PICUM. We will also hear from Lavinia Banu from the European Commission, DG Justice and Consumers. And finally, we will hear from Irma Borde, also from the European Commission, Department for Employment, Social Affairs and Inclusion. So thank you for being with us today. And I will start by giving the floor to Alina Smith from PICUM, who will tell us about the challenges that migrant or undocumented children face across Europe in accessing health and social services, and also the need to ensure the optimal development of children in early age. Alina, I think you have some slides to share.
Yes, I do. Thank you very much, Geraldine, for the introduction. So it's very much a pleasure and a delight to be invited to join you today. Thank you very much. And so the perspective of my presentation will really be to bring the realities and context of undocumented children. So I hope you can now see my slides.
We can, thank you.
Super, thank you. So yes, indeed. So yes, I will bring us to consider a few questions together. So first of all, who are we speaking of when we're speaking of undocumented children? And how do we think about and understand the rights that they have under international and EU law? And then how do we understand what the reality is of their situation in terms of access to essential services? And I'll just end very briefly at the end with a note about the opportunity represented in the Child Guarantee. So who are undocumented children? So I think most people understand, of course, that being undocumented is not an immutable or unchangeable characteristic of a person, but something that is very much a matter of the policy environment and the rules around who can obtain a permit or visa and under what conditions. And so undocumented children might have come irregularly to Europe, or they may have been born in Europe to undocumented parents, or they may have had parents who at some point along the way lost their resident status. So undocumented children, the term includes children who are unaccompanied or separated from members of their family, but also the very many undocumented children who reside with their family members. What we do understand of the situation of undocumented children is that most of them have been here for quite some time. So we're speaking in many instances of children who've been settled in Europe for 5 or more years in their country of residence in Europe. And we know that some undocumented children are aware of the fact that they have a regular status and some are not. But that the fact of being undocumented and their knowledge of this, when they do realize it, can have an enormous impact on a child's sense of identity and sense of self and also sense of belonging. So we don't have a lot of research or data on the situation of undocumented children, but there have been some recent studies, one in particular that's interesting from Spain, where their research showed that fully 20% of children in migration in their study are undocumented, and about half of those children were under the age of 10. We also know that undocumented children experience significant levels of poverty. Although we don't, again, have an enormous amount of data about this, we do have some evidence, for instance, from Belgium and from the Netherlands that indicates indeed high levels of poverty in undocumented families. And evidence from Spain, once again, from workers who were apprehended in an irregular situation from last fall. Those workers earned €2 per hour, which is 1/3 of the mandatory minimum wage in Spain. So, of course, the limited economic rights and opportunities of undocumented children's parents has an important impact on the income earned by the family. And this can have obviously an important impact on the well-being of the children. And of course, related to the fact of irregular status and the uncertainty and precarity that often is associated with that is the experience of chronic or toxic stress in the life of an undocumented child. And of course, this has important long-term implications, including with respect to that child's health. And we know that as we're going to come to limited access to services in the national context, it's often through informal support networks that families try to really bridge the gaps that they have in terms of access to care. PCOM just recently produced a report actually on what it means for children with irregular status to navigate that irregular status, or what that status means in terms of their ability to access decent housing, services, what it means in terms of poverty, their experience of residence procedures, school life, and so on. So I wanted to turn then to what does the legal framework tell us? As it happens, the EU has, and every member state within the European Union has an obligation to promote the rights of children, regardless of their status. And this stems first, of course, from the UN Convention on the Rights of the Child, which has been ratified by every member state in the European Union, and where there's no distinction based on the status, the citizenship, or the migration background of the child. And this, of course, includes, as all of you, I think, know very intimately, rights with respect to healthcare, education, nutrition, and housing. In terms of EU law, I think it's also important to underscore that the EU treaty is very clear on the obligation to address social exclusion and discrimination in a number of respects, including with respect to protection of the rights of the child. And also there's the EU Charter on Fundamental Rights, which is very clear with respect to establishing that the children should have the right to such protection and care as is necessary for their well-being, and that the best interests of the child must be a primary consideration in all actions related to that child. And of course, the EU has shown its political commitment with respect to children in migration, including in 2017, a European Commission communication inclusive of all children in migration, regardless of their migration status. And of course, that communication addresses issues around early childhood education and also underlines that access to inclusive, non-segregated quality education must be guaranteed, amongst others, through non-discriminatory treatment, regardless of resident status. So now, of course, I'll turn to what is the picture in fact. And the fact remains, unfortunately, that there is an enormous gap between the rights of undocumented children as a matter of EU law and international human rights law and their experience in practice. And we see that undocumented children, children with precarious resident status, are among children at the greatest risk of exclusion and poverty in Europe. And that in reality, social rights are very strongly correlated with a person's resident status, which means that the absence of a strong, secure resident status is an enormous impediment to accessing essential services. So I'm going to say just a brief word about early childhood education, and most of my remarks are really focused on the context of access to healthcare. But the reality is, of course, extreme limitations in undocumented children's access to early childhood education. There are just some examples to maybe briefly reference, which are included in a report that we did some years ago, including in the context of Belgium, where at least in terms of the Flemish region, there was a specific information campaign that was put in place to really encourage participation of the very youngest children in early childhood education that specifically targeted new migrants and children whose mother tongue is other than the national language. In France, national law is clear that all children can be enrolled in preschool closest to their residence, and this is the case regardless of their resident status. There are also inclusive examples of practice at the regional level in Italy in terms of inclusive approaches to early childhood education. Briefly, in terms of access to healthcare, the reality for undocumented people in general is that there's a trend towards exclusion, where if you're an undocumented person, by and large, your irregular status means you'll have an extremely limited access to primary healthcare in most European countries. There are some exceptions that I'll speak to in a moment, but underlying that is, of course, a pervasive fear of the authorities because of a history of prioritizing immigration status, and the risk in some countries in particular that engaging with social services and with the healthcare system can potentially expose people to immigration control. So in terms of undocumented children in particular, by and large, there are generally more generous provisions under national law in terms of access to healthcare for unaccompanied children than for children and their families. But generally speaking, undocumented children face the same barriers and have the same entitlements to primary healthcare and other forms of healthcare as their parents, as adults. There are some member states, and we counted in 2015 9 member states, that do grant the same access for undocumented children as for children who are nationals of that country. But it's still the case that in the majority of member states, outside of the context of emergency care, undocumented children face significant barriers in accessing healthcare. We did a report a few years ago on access to sexual and reproductive health services for undocumented people. And we saw that although there is this trend towards exclusion, there are carve-outs in a number of countries for maternity care. So actually a majority of member states do provide certain carve-outs, if you will, that allow pregnant undocumented women to access certain types of care. But how this is defined and how broadly this is defined varies considerably from one country to another. And I think it's very important to note that in a majority of member states, this carve out for maternal care for undocumented women, pregnant women, is disconnected from a broader entitlement to primary care. And so it's really specifically around access to care in the context of their pregnancy and not more generally to primary health care. There are, I think it's important to note, a handful of countries that do provide quite comprehensive bases for care for undocumented people, at least as a matter of law, although in principle, in practice, we know there are a number of barriers that continue to exist. But I think that it's important to highlight where this type of comprehensive care is at least foreseen under national law. And that's the case in Belgium, for instance, in Italy, France, Portugal, and Spain. And in many of these countries, this is very long-standing as a matter of many decades. But we see by and large that it continues to be the case that irregular status is a very, very significant barrier to an undocumented child accessing essential health care. And as a result, thousands of children in Europe are not getting the start they need in life, with long-term consequences on their well-being. So my last slide is about the opportunity around the child guarantee. The EU Child Rights Strategy and the Child Guarantee are so important as signals of the European Commission's understanding and acknowledgement that all children need the best start in life. And we see that children with uncertain, precarious, or irregular status are some of the most those facing some of the most significant challenges and are in the greatest need, and therefore for whom there could be the greatest impact. And we see the importance, therefore, of being explicit about their inclusion in the guarantee to effectively ensure, in fact, to be effective in encouraging member states to really make use of available funds to address the significant gap that continues to exist between their rights and the reality that they confront in the national context. Thanks very much.
Thank you very much, Alina. This is really important and interesting information, and we will also hear about the child guarantee a little bit later by our colleague from DG Employment. But for the moment, I will invite my colleague Lavinia Banu from DG Justice and Consumers, who will give us an overview of the new European Roma strategic framework and the Council recommendation. Lavinia, the floor is yours.
Thank you very much. Thank you. Can you hear me?
Yes, we can.
Perfect, perfect. Thanks a lot for having invited me to this event, and thanks a lot to the previous panelists for their very inspiring interventions. I was asked by the organizers to provide you with a short overview of the new EU Roma strategic framework, and with the focus, of course, on early childhood education, and where does the focus when it comes to Roma children, how is it conjured within this new initiative? So, as you might all know, last year in October, the Commission has adopted a new EU Roma strategic framework for equality, inclusion, and participation. And if we compare it to the previous EU Roma framework, we can already notice that there is a shift in approach. Whilst the previous Roma framework has focused on socioeconomic integration of marginalized Roma, the current one has a more complex focus on three main policy pillars, such as equality, inclusion, and participation. And before I head into the actual content of the new strategic framework, I would just like to mention from the very beginning that, in fact, the Commission has put forward for the member states a very complex package. And this package is composed by the communication itself, with guidance for the national Roma integration strategies for the member states, a portfolio of indicators that has been developed by the European Commission together with the Fundamental Rights Agency and the member states themselves. And as it has already been mentioned, the Council recommendation on equality, inclusion, and participation, which is composed with specific guidance for concrete measures to achieve EU objectives and targets. Also, this package contains a staff working document which outlines the methodological, analytical, and contextual basis of the proposals, of course, on the basis of data provided by Fundamental Rights Agency, which has been a crucial partner in contouring the work on Roma inclusion for the next 10 years. Now, in terms of novelties, when we talk about the Roma inclusion for the next 10 years, we consider that it has a stronger impact. It has a stronger impact when it comes to stronger focus on diversity among Roma. And when we talk about diversity among Roma, we talk about women, youth, children, elderly Roma, LGBTI, EU mobile citizens, stateless people, or people with disabilities. In addition to this, we can also notify that, in fact, the new EU Roma strategic framework has an aim to reach out to all Roma, so not only the marginalized ones, but also to the society at large. And this is very important because, as I was telling you before, this has not been the case of the previous framework, and we've seen the need to further build on these aspects. In addition to this, there is also a stronger focus on combining mainstream Roma inclusion across policy areas with targeted measures supporting effective equal access to rights and services. And there is also a differentiated approach amongst member states within a common framework. And when we talk about this, there is a list of requirements that we ask all the member states and measures to put in place. But in addition to this, as we know, there are certain member states with a higher number of challenges and also with larger Roma populations. And for those ones, we have spelled out additional measures that should be put in place when it comes to Roma inclusion at the national level. We are talking about 7 interlinked objectives when it comes to Roma inclusion. And we are talking about fight and prevent anti-Gypsyism and discrimination, reduce poverty and exclusion to close the socio-economical gap between Roma and the general population, promote participation through empowerment, cooperation, and trust. And all these are again connected to the 3 main political pillars that I have mentioned at the beginning, and these are broken down in other 4 sub-objectives, to put it like this, such as increase effective equal access to quality inclusive mainstream education, increase effective equal access to quality and sustainable employment, improve Roma health, and increase effective equal access to quality healthcare and social services. And nonetheless, increase effective equal access to adequate desegregated housing and essential services. And we know that this is particularly relevant when we talk about social, the status of the Roma population in the member states. And in order to provide you with a more clear picture of how we want to break down these objectives into concrete measures, I would like to outline for you a few examples of EU headlines targets up to 2030. So as a EU baseline, we have participation in early childhood education and care, where we have a percentage of 42% of Roma children as compared to 92% of general population. And therefore, the target until 2030 is cutting the gap in participation in early childhood education and care at least in half. Then again, another EU baseline is life expectancy gap, where we have 10.4 years for women and 10.2 years for men between Roma and general population. And here again, the target until 2030 is cutting the life expectancy gap at least in half. And then when it comes to housing deprivation, where we have a 61% of Roma compared to 80% of the general population, and the target until 2030 is reducing the gap in housing deprivation by at least 1/3. And when it comes to overcrowding, again, something very specific to the Roma context, where we have a percentage of 78% of Roma compared to 70% of the general population, where the 2030 target is cutting the gap in overcrowding at least in half. And since we mentioned the Council recommendation, I would like to emphasize a little bit on the importance of this new tool that has been adopted quite recently in March during the Portuguese Presidency. And it's highly important because it gives stronger guidance to the member states to renew their commitment to addressing the challenges faced by Roma communities. And it also spells out concrete measures for member states to adopt and implement in their efforts to achieve equality, inclusion, and participation the participation of Roma. And this is done or portrayed, to put it like this, in 5 main chapters, which are combating anti-Gypsyism by promoting equality, inclusion, and participation, sectoral objectives in education, employment, health, and housing, partnership and institutional capacity, funding, and monitoring and reporting. And since it has been already outlined in the previous interventions, the need for a cross-cutting approach. I would just like to mention also that the new initiative is consistent with the European Pillar of Social Rights. It is designed to increase social fairness, irrespective of sex, racial or ethnic origin, religion or belief, disability, age, or sexual orientation. It is also highly relevant, especially for Principle 1 on quality and inclusive education, Principle 3 on equal opportunities, Principle 4 on active support to employment, or Principle 20 on access to essential services of the social pillar. In addition to this, and I think this is highly relevant for our discussion today, since we are facing for quite some time the context of the COVID. And in order to tackle the specific challenges that have emerged throughout this very challenging period, member states are highly encouraged to tackle the digital exclusion of Roma children by providing access to digital technologies, in particular access to and support for online and distance learning, especially when education and training institutions are closing down, which we have actually witnessed during the COVID pandemic. And before I close my intervention, I would just like to outline what are the next steps forward, because the new EU Roma strategic framework has come out last year, and now we are in the process of working with the member states in order to define the actual approach for the next 10 years. And therefore, what is highly important is to continue the work on definition of national measures in cooperation with all stakeholders and the use of the portfolio of indicators that I have mentioned at the beginning of my presentations. And also member states, as you may already know, are asked to submit their national strategies by September 2021. So in a few months, member states will be asked to report on implementation every 2 years, starting with June 2023. And once this is done, the European Commission will publish midterm evaluation and an ex-post evaluation based on the member states and civil society reporting, but also on the very important FRA surveys. A very important lesson, I think we've all taken up by implementing and working on the previous framework is that we need a lot of patience, and we all need to bear in mind that tackling discrimination and exclusion requires long-term commitment, and therefore all the efforts have to be calibrated and sustained over the years. And all the actors need to be equally engaged and willing to support the process. And since I'm aware that our presentations sometimes are very technical and they contain a lot of information and headlines and targets, I would just like to share with you and showcase through a video the impact and the consequences of inequality when it comes to Roma from the moment of birth to adulthood. So if I'm allowed now, I will just share my screen. Well, this was it. Thank you so much. And I will stay put just in case you'll have further questions on my intervention. Thank you.
Thank you, Lavinia. That was a really beautiful and inspiring video. I will now give the floor to Irma Borde, our colleague from the European Commission who works in the Department for Employment and Social Affairs and Inclusion. I think, Irma, you've been involved in the preparation and the negotiations on the directive on work-life balance for parents and carers, and that now you are dealing with policies aiming at fighting poverty, social exclusion, and inequality, and you will tell us more about this very recent Commission initiative, the European Child Guarantee. The floor is yours.
Yes, thank you, Geraldine. Thank you, colleagues. I hope you can see my presentation. Let me know if there are some problems.
It's fine.
It's fine, thank you. Yes, this film was really tricky to put in before just my presentation because it's so hard to not to cry while seeing this. It is really great initiative. So today I will tell you very briefly about the recent Commission proposal for a Council recommendation establishing European Child Guarantee. I will be brief because I'm pretty sure you know already this proposal quite well because it was long awaited. It was initiated by the European Parliament as early as in 2015. So after all this long preparatory analytical work and preparatory action, the Commission finally managed to put the proposal and have it adopted by the College in March. I will not repeat why basically this proposal because this would just overlap with all what has been said today. So it's basically to prevent and to combat poverty and social exclusion and break the intergenerational cycle of disadvantage due to poverty and various factors leading to poverty, because poverty is only one factor that causes that certain children have unequal start in life. It's also to prevent all the long-term consequences, and you can see them already on this circle, like long-term unemployment, problems related to early school dropouts, problem related to health, and basically with overall well-being and being successful in life. So we hope this proposal, although it is not the only instrument, and I think it should not be also perceived as the only instrument addressing child exclusion, social exclusion, or poverty, because the drivers, as you know, behind are far more complex, and it's not only about unequal access to certain essential services, but this is also and I think predominantly due to the labor market situation of parents, the income situation of parents, and various range of factors. With this proposal, we wanted to remain focused. We want to focus only to ensuring equal access to certain essential services. We selected very carefully those services, but as I said, this initiative should be looked at within the broader context of various initiatives proposed by the European Pillar of Social Rights and then reconfirmed in the action plan implementing the pillar. It should also be seen as a contribution to reducing the headline target in the Pillar Action Plan, which is to lift 15 million people out of risk of poverty or social exclusion, and within this broad group, at least 5 million should be children. Just to reiterate that this is complementary initiative to the, basically it builds up on the previous commission, recommendation investing in children. This commission recommendation from 2013, it still remains valid because it exactly addresses broader aspects related to child well-being, focusing broadly on, it has universal approach to children, while proposal on child guarantee offers targeted or progressive targeted approach toward dealing with child well-being. It also complements the EU strategy on the rights of the child, and it's very, very complementary also to the Council recommendation on Roma inclusion. As you will see, it has very many common elements to that recommendation as well. So what is the target group of the child guarantee? Basically, the guarantee addresses children until the age of 18 who are at risk of poverty or social exclusion. So we are called these AROPE children. However, taking also into account, as I said previously, various drivers of various disadvantages which even exacerbate poverty or social exclusion, we would like to encourage member states to look within this broad group of children at the specific disadvantages faced by, for example, by homeless children, with children with disabilities, children with a migrant background, and here by migrant background, the recommendation says that it's regardless of the migration status. So this is in line which Alina was presenting previously, that basically those children, undocumented children, they face the biggest challenges in accessing services. Therefore, our recommendation recognizes this fact and invites member states to ensure access to the services for children regardless of their migration status, whether they are legal, undocumented, or not undocumented and illegal migrants. We also look at children in minority racial ethnic background, and here it's particular focus on Roma, and hence the complementarity to the recommendation Lavinia was telling you before. Children being in alternative and in particular in institutional care, because of course the Commission line is that we should prevent the institutionalization of children. So we also look at this aspect in the child guarantee. And the last category is, we are aware it's a very broad category which kind of gives example other precarious family situation which may lead to risk of poverty or social exclusion, like, for example, living in single parent household or having imprisoned parent or parent with a disability or mental long-term illness. The list is here, it's an indicative list, and within member states, of course, based on national circumstances, they may broaden this group by our other groups of children who face particular disadvantage in a given member state. What is the material scope of the child guarantee? It's very simple, really. If you read the recommendation, it has only 12 articles. It's pretty straightforward. We wanted really to pass on strong and powerful message to the member states. So basically, the recommendation invites member states to ensure free and effective access to early childhood education and care, education, including at least one free school meal per day. We also would like to see free and effective access to healthcare and effective access. Here the aspects of free of charge is replaced by affordability principle. So effective access to healthy nutrition and to adequate housing. It was careful consideration which services should be for free and which services should be provided as affordable services. It was also very carefully analyzed in our preparatory action and various supporting studies. And as I will tell you later, since we started negotiations already with the member states, this is one of the points where member states have divergent views, very often deviating from our Commission original proposal, but I will come back to this later. Here on this slide, you will see how we define effective access and free access. So these services need to be available, need to be affordable in a case of effective access, and free of charge in case of free access, of course. They have to be accessible, they have to be of good quality, provided in a timely manner. And what is also important, the potential users, they have to be aware of their existence, and as well as the entitlements to use the services. By this last component, we wanted to address the issue of non-taking up certain services, either because of fear of stigmatization, or because families and potential with children with special needs, they are not aware that such service exists. So one of the components of this access is just to make sure that potential users are aware of the services. Under each, this is not presented on this slide, but as you can imagine, under each of the service, we provide guidelines to the member state, guidance to the member states. What do we mean? How could they improve this free access or effective access? I will not list them because the list is really very long, but it's basically about inclusive education, providing school uniform, providing free meals, ensuring school transport. In case of healthcare, is just taking care of a child from the moment he or she is born throughout the life cycle, ensuring access to prevention, regular health checkup, dental checkups, also to detect any diseases as early as possible. Nutrition, of course, to limit the nutrition of food, unhealthy food in school premises or in kindergarten, and educate families with children what is about healthy nutrition, to avoid salty or rich in fat nutrition, and this kind of measures. And with regard to adequate housing, to access to housing, just to prevent families, prevent the homelessness among families with children, prevent putting families in shelters, rather to try to find for them quality alternative accommodation. Also to review existing housing benefits, just to see how much they take into account the needs of families and children in need, and of course, needless to say, prevent children being put in institutional care. This is one of the really very important issues for us, and also for the member states. This is really, they are very careful about this, and they are very supportive and very strong in promoting the institutionalization of children. Similarly to the recommendation on Roma, on integration of Roma, we also put emphasis on governance aspects, because learning from mistakes, if I may say so, the 2013 Commission recommendation did not foresee really like sound monitoring and evaluation arrangements, which also was kind of one of the critical findings of the evaluation of that recommendation and also of the findings of the European Court of Auditors. So one of the recommendations of the European Court of Auditors was to ensure that the child guarantee has proper sound governance, monitoring and evaluation arrangements. Therefore, in our proposal, we would like that member states establish a national child guarantee coordinator who would have relevant mandate and resources just to oversee the implementation of this recommendation and to be a liaising to liaise with the Commission, be a contact point for the Commission when it comes to the implementation of the recommendation. Member states should also identify children in need and particular barriers they face in assessing the services. And here we really believe that member states, they know best who are the children in need in the member states at national level, at regional and local level, because very often those children are very, very small disadvantaged areas or in a particular territory. So it's up to really to the member state to identify those children. And on that basis, after identifying them, draft the national action plans in which they would include targets, numerical targets, focusing on groups of children in need they identified, as well as corresponding measures, monitoring and evaluation arrangements. We would like to have these national action plans covering the period until 2030 in order to be able to monitor it hand in hand with the monitoring of the social pillar action plan, also to see the contribution, the achievement of the recommendation to this target of lifting 5 million children out of poverty or social exclusion, therefore this time frame. We also would really very much would like to see that while drafting the plan and when implementing the recommendation, member states involve all the relevant stakeholders at all levels of administration in drafting, implementing, and the whole process related to the implementation of the recommendation. It's not only about administration. This slide is a little bit simplistic, but it's also all the relevant stakeholders, civil society organizations, particularly dealing with children's rights, also social services providers and children themselves, because this is also very much voiced by the civil society, by various stakeholders, by you at this meeting, that without involving the stakeholders, this might turn into purely administrative exercise with really very limited added value. So this is really important to outreach and to involve everybody from the scratch. And the member states should report to the Commission every 2 years. And now when it comes to the follow-up by the Commission, we would monitor the child guarantee within, we would use the existing processes. The intention of the recommendation is not to create additional burden on the member states or on the Commission. We would like to use the existing mechanisms. So for this purpose, we would keep on continuing the situation of children and at risk of poverty, of social exclusion, and of this, the implementation of this recommendation within the European semester. This is already well-established process. As you know, there have been a number of recommendations addressing various issues related to child poverty throughout the year. So we are going to strengthen this monitoring, but use it as the main vehicle to monitor the recommendation. We also intend to work closely with the member states and the child coordinators and the social protection committee. And with regard to the latter, we would report regularly to the Social Protection Committee on the progress in implementing the child guarantee based on this regular reporting from the member states. We talked today, we had some voices about the importance of indicators. This is indeed the case. So we are planning to work on 2 layers. First, we would like to get involved with the Social Protection Committee to develop a common monitoring framework as much as it's possible, because we are all aware of the of the obstacles. Certain indicators are hardly accessible based on administrative data or on surveys. And for example, when it comes to early childhood education and care, we have really an ample of evidence how the situation looked like in member states, but you imagine on healthcare, for example, and children in need, or a nutrition aspect, or on housing, we have to very often base ourselves on existing resources, but this just does not enable us to have comparison across the EU. Therefore, we would like to see together with member states how far we can go in developing a common monitoring framework just to capture the main building blocks of the child guarantee. We would like also in general to enhance the availability of comparability of data, not only related to the child guarantee, but to broader child welfare policies, including also benefits, family benefits in kind or in cash, just an example, but here we also have significant gaps. So we would like to use this momentum to try to develop also for us to have more insight what is going on in the member states when it comes to child policies. After 5 years after the adoption of the recommendation, which we really hope will happen soon, but I will come back to this in a while. So in 2026, assuming that the recommendation will be endorsed still this year, we will review the progress and we are going to report to the Council of the progress. And on that basis, we will see if any revision would be necessary to the recommendation. And of course, the Commission will strengthen awareness raising, dissemination and communication activities, but this is our, I would say, bread and butter, so I would not go into detail about this last point. Now about the state of play. So we had already 2 very useful meetings with the member states. The next one is next week. The negotiations are led by the Portuguese Presidency, and the Presidency is very much committed towards having this recommendation endorsed by the EPSCO Council already in June this year. What are the positions of the member states? I cannot go into detail, as you imagine. This is the process is still ongoing, so I cannot really share with you too much of details. But as you imagine, the most contentional issue is the issue of free services. Some member states are not keen on having this provision in the recommendation. They would rather see provisions like that services should be affordable. So of course, for us, this is lowering significantly the ambition of the proposal, and we hope this the position of those member states who are concerned, they will change their position at the end of the day. The other issue, which is also widely not contested, but it's issue of concern for quite a number of member states, is the time for the preparation of the national action plans, because in the recommendation we suggested 6 months. Because this is clearly the urgency to act. COVID programming of the European funds, notably the ESF Plus. There are these 11 member states which are concerned by this 5% of the ESF allocation to address child poverty and social exclusion. Therefore, for us, for the Commission, there is really no time to wait. It's just now we have to those plans have to be ready as soon as possible. However, some member states claim that they need more time. They need more time to consult all the relevant stakeholders and do it really properly, and that the quality should be put over the speediness of the process. So those 2 issues we still have to see how to accommodate concerns on some member states. So this is still ahead of us. But all in all, member states are very positive about this proposal. They say that it was long awaited, really, and they are very supportive in general, and really going in certain points, they are going a little bit a little bit, even they are a little bit more ambitious compared to our wording. They want to broaden the groups of children in need. They want to broaden the list of measures to ensure equal access to the services. So all in all, I think we are on the same page. It's just several, these two, maybe three issues which need to still fine-tune our position. So this was it from my side, and I also will stay here should you have any questions on the child guarantee. Thank you.
Thank you very much, Irma, and good luck for the negotiations with the member states. We hope the ambitious objectives are actually achieved. We've had a number of questions, and there was one in particular which I found really interesting from Prevention and Early Intervention Network in Ireland, who asked how to strike the right balance between universal supports for all children and families and targeted supports for those most marginalized. There have been already some answers in the question and answer section, and progressive universalism seems to be the answer, but maybe we could ask Mihaela to give us a little bit of explanation of what we mean with this and how that works. Mihaela, are you there?
Yes, I'm still here, of course. Yes, I was already kind of typing the second answer. I mean, kind of reinforcing the approach of progressive universalism, because it's about how the system is designed. A tier system does not mean that you have separate services for separate needs, but you have the same services that are providing different intensities of support. Ones that are for all of them, some that are for those that need additional support, and some that are exclusively for those that need very specialized support. So that does not, it's a tiered one. So inside the same service, which is different. And you can always choose what is needed depending on the community where that service operates. That's what the progressive universalism is saying. You need to have responsive services to the needs of the community where you operate. Not that there is one kind that can replicate in different places. And this is what actually, we still have a problem here because traditionally, there was one kind of service that was provided for all of them. And then we created separate one for separate groups. This is not the way, it doesn't work anymore because communities the diversities are multiplying. And that means that you need to adapt even the kind of service that you are providing at that community level for the population that you're having. That's where I think the whole discourse, the narrative around integrated services, it's also around this idea of how responsive we are for the communities and the families and children we have in those communities. That's why we have lack of services. That's why there's no access to services, because they are not existing, because there has been like one template created and that has been scaled up at the national level, but not this model of having services that are providing different types of support with different intensity, of course. And that was the comment that was put in the chat from the colleague in Ireland. It requires resources. It's very true, but it's a clever way of putting resources. So the question is how we are spending the resources and how we are investing the resources. And it is very much about the workforce. It's about the staff. What categories of workforce we have in those services so they can respond to the diversity of needs. So I think it's theoretically, it sounds very good. And there are countries that have already started this pathway. And I think the toolkit that we have developed in the working group, I think it's a good indication that such kind of tier systems already exist. Now, it's not just about early education and care. Now it's about different types of services for different types of needs that children have that are not related only to education and care, but also to health, to nutrition and everything. So the integration also talks about the same thing. Are they universal and integrated services that are provided for all children? And are those that are for specific needs also integrated? And for those that are really requiring specific support, how they are also integrated. So it needs a bit of more thinking of how our systems are operating today, especially for the youngest ones.
Okay, thank you very much, Mihaela. We just have time for one more question, and maybe this is for Irma. In the draft recommendation on child guarantee, parents are not mentioned as stakeholders to be consulted. Why is that? And do you have any plans to actually involve them, maybe at European level or national level, so that they can be part of the strategies for the child guarantee? Irma?
Yes, indeed. This is one of these things that also member states were very attentive to, and basically themselves already changed the text accordingly. So it was not intentional on the Commission side. For us, it was obvious wherever we refer, and we refer on many occasions in the recommendation to families. So for us, it was also involving parents, but maybe indeed the text could have been clearer in this regard. But member states are taking a proper care, and this is one of these added values they brought to the text. So I believe it will be changed in the final version.
Right. I like that as a policy officer and as a parent myself. So thank you very much to our speakers for their very interesting presentations this afternoon, and to our audience for their questions and their commitment. I will now turn to our last guest, Mr. Dragoș Pislaru. I think you are with us. I saw you before, I can't see you anymore, but I think you are here. Yeah. Mr. Pislaru, you are an economist. You have been a researcher, professor, consultant, successful entrepreneur, also serving as Romania's Minister for Labour. You helped kickstart numerous international projects on social affairs, rural development, social policy, labour markets, and digitalization. And you are currently a member of the European Parliament, where you coordinate the work of the Renew Europe group in the Employment and Social Affairs Committee, and very importantly, the vice chair of the Intergroup on Children's Rights. So as we are coming to the end of this workshop on the role of early childhood development to reduce inequalities, can I invite you to share your thoughts on this topic?
Merci, Geraldine. Thank you very much. I would like to thank first the organizers, the European Public Health Alliance and Eurochild, not only for allowing me this great honor to share my thoughts on the European Child Guarantee, but also for being our partners and for the great collaboration that has defined our interaction every time that we've been, working at a proposal that affects children. And then indeed, I mean, what kind of policy proposal does not affect children? On one hand, there are policies that have a direct impact, like the child guarantee that we're working right now on, and these policies with direct impact are aiming to target through different kinds of measures the most vulnerable of children, those living in poverty and social exclusion. On the other hand, we have a lot of broader policies, and I would really love to see that we are not going to forget the other policies. So, for instance, the Recovery and Resilience Facility. I've been a co-rapporteur from the European Parliament on that. And these type of packages have an impact on the whole society, but also affects considerably children's lives, the next generation. And just to explain, I mean, the first version that came from the Commission and the Council of the RRF regulation, probably you already know that, but didn't include the word children in it, and it was called the Next Generation EU. So it is actually our work together to be sure that these kind of general, broader regulations are actually, designed and implemented with children in view. Now, this is how I see things. I mean, once we acknowledge that the proposal is put forward and has an impact on children, on our next generation or on the future, then we can certainly, try to analyze, the design and, how these can be implemented and so on. And when it comes to fight against child poverty, and this is actually, the same thing that can apply for other parts of social policy, the starting point should be to avoid silo policies and adopting a holistic approach. And that's something that you've been discussing in the panels beforehand. So the problem that we are facing right now is that we have an array of solutions coming from different fields of activity, usually, indeed under aligned ministries, such as the Ministry of Labour and Social Affairs, or how it is coined in different member states. But what we are actually lacking is actually, the overall holistic approach that will allow social workers to work with education counselor, with medical counselors or assistants, with people that are, more or less related to the culture and sports activities, to the housing, developments and so on and so forth. And that's actually something that it's actually important at the commission level, where basically we have a DG as a line, let's say, an equivalent of a line ministry, a DG employment, that should be hand in hand with all the other DGs on this particular topic. And there are, important efforts under this particular line, but it's difficult. The same applies in the member states, where at the central level, you have different ministries, and there is this temptation to have this silo policy going on. And if you are adding the third tier, that is the local tier, and I was actually following closely what Mihaela Ionescu answered related to, to the fact that we should not, just develop service by service, but should have an integrated approach at community level. This adds to the complexity of it. So what we are right now trying to do, and this is the new generation of policies with evidence-based behind us and so on, is that if we really want to have children at the let's say there's a focal point in our societies, then we should have a package of measures in an integrated fashion, putting together health, nutrition, social assistance, education, skills for labor market, and so on. Because if we choose to address this issue separately, we are not going anywhere near ending child poverty. So the first thing is coordination and the way in which we address it. The second thing, which I think that it's quite often overlooked, is the need to combine public and private investments. And this is something that I'm really using the word investment, not just to talk about to try to coin the expenditure that we need to put forward, because I really believe that it's an investment with a return for the society, a return that is not only social in terms of impact, but it's also economic in terms of impact. And I will use the word investment more and more in the near future. And I think that this kind of investment, which we can say it's social impact, social impact investment, this should be the norm. This shouldn't be the exception. This shouldn't be, just something nice to have in addition to what the public services are doing. I mean, the idea that money can be spent in joint public-private ventures, be that private in terms of civil society or private as, private business, entrepreneurship. I mean, this is something that should be seen as investment and treated to generate the highest potential, return for society. And I mean, we've been talking about housing and importance of housing. And I mean, there are so numerous ways to perceive, that housing investment is something that has the direct return on society. But the best examples that we have are related to education at an early stage, to health prevention and things like that. And here we have the evidence suggesting that the returns of the investments are actually rivalrizing the returns what you have on high-tech companies, on high-tech startups. It's up to 14 times the return on investment. So what it's actually, for me as an economist, striking is that when we talk about, high-tech startups, we think, how, these are really sexy investments. Everyone is talking about them, this is the future and so on. But when we talk about the fact that we have a similar multiple and returns for investing in children, for instance, I mean, it's just a niche thing where, a bunch of people from the social, whatever realm are actually dealing with it. And what I really want to do is to mainstream that, to have that at the center of our society, to have the business sector really investing in that because it's worth doing that, not because it's nice or moral, to do that. And if we have a public service that will deliver from an integrated perspective, and then we have this private sector that realizes, civil society and entrepreneurs that realize that there is an impact on their businesses and there is an impact on and return on investment, then we are going to have the resources available and needed to do something. And this is very important. I don't believe that social policy or investment in children is doctrinary anymore. I believe that we are way past that. I believe that a social contract needs to be rewritten right now, where social means to actually care about, how we develop our societies, how we avoid extremists, how we avoid people, not to suffer, not to be, struggling from one day to another and being the game for politicians that are at rather the extreme left or extreme right. So that's actually the thing. I think that we are right now to be united from a doctrinary point of view. We will be united from a public-private perspective, united from a line ministry that needs to be, shifted towards an integrated approach. And to conclude, the potential of this concept that I'm actually putting forward is really immense. I mean, it's really that can actually change things again from something that it's important and, always, listed in the priorities of every government, but not mainstream, and something that should be mainstream and at the core of the societies. And I will actually fight for, avoiding this silo policy, having the private sector on board, and trying to build bridges in the European Parliament and generally speaking when it comes to children. And I think that the recent efforts related to coordination of the national efforts with the national coordinator and national action plan as part of the child guarantee are good things. I even suggested to have a European authority, or not an agency, because the competence is not there, but an authority that would actually coordinate things, similar to the European Labour Authority that we have in Bratislava. My conclusion is that this is an immense potential. The stake is huge. It's the right now. It's actually to be sure to ensure that fewer and fewer children grow up in unacceptable conditions. I think that everyone should actually have that as a priority. That's for me the promise of what is going on. That's for me the promise of the child guarantee, and that's something that I would be actually fighting, with you. And all the other marvelous people that are really struggling and have spent their entire lives for the benefit of children in Europe, for this better future. I'm a father of 4, and I'm really motivated to fight this along with you. So that would be my conclusion, and I would like again to thank you so much for allowing me to congratulate you for all the work and to put forward my commitment to have this and stand together in this particular endeavor. Thank you so much, and I wish you the best of luck.
Thank you very much. I will now pass the floor to Agata Dadato. Thank you for these really, really exciting ideas, and I hope we can actually live up to our commitments. I'm sure we will all together get there. Agata, now the floor is yours to conclude.
Thank you very much, Geraldine. And I really, really want to warmly thank MEP Dragos Pislaru for being such a great champion of our shared agenda to improve the lives of children and young people across Europe, starting from their earliest years. Dragos' passion and commitment has really accompanied us throughout this journey. And now what we're seeing is that really at EU level, we have incredible traction. It's pretty big that the EU has launched the recommendation for the child guarantee, the EU strategy on the rights of the child, that the governments will be required to develop national action plans on the child guarantee, that they have national coordinators. It's really a long-term gain. But if we're not influencing and using and harnessing that momentum, then we're really losing an enormous opportunity. With the first priority campaign, we're really in the long term and building the community, the ecosystem of civil societies that is sustaining and focused on inclusion and services that respond to the needs of families and communities, and being ready really to harness the political change if and when it comes. Now I'd like to invite Radost and if our colleagues, please, if we can show on the screen our 2 proposed recommendations from this workshop discussions. We have really an extraordinary opportunity Thank you, Radost. We have an opportunity to increase government's attention to and public investment in quality early childhood development services. With these recommendations, civil society is really voicing that early childhood is important, and this is quite significant. So I'd like to ask please write on the chat if there is any echo or any disagreement or any addition that you want to make to these two recommendations. And in the meantime, I would also like to invite Radost for her concluding remarks.
Thank you very much, Agatha. I will be very brief because we are running out of time. I would like to say that the European Pillar of Social Rights Action Plan, it's a great opportunity and it provides strong foundations for advancing socioeconomic rights across Europe, but also for strengthening the investment and the protection of vulnerable groups. I would like also to say that this time we should not miss the opportunity to advance health equity and social justice across Europe through the European Pillar of Social Rights Action Plan, but also other major European and national policies. Now, I would like to thank you for moderating this debate, but also I would like to thank our panelists and our participants for their contribution. I would like to thank in particular MEP Dragos Pislaru for his great contribution to this discussion, but also for his sustained commitment to advance social and economic rights of children, especially those belonging to vulnerable groups, through the intergroup for children's rights at the European Parliament. So this event is coming to an end, but the discussion will continue. Those who wish can join the discussion on social media, and we will be happy to answer further questions and provide you with more information about ongoing activities addressing early childhood development in its role for advancing health equity and social justice across Europe. Thank you very much. I wish you good afternoon. Thank you.